The next presenter, yes, Dr. Manisha is there.
Yes,
Dr.
yes.
Manisha.
Yes.
Namaste. Also presenting an ROP scenario at Bharatpur, Chitwan. So kindly go on.
Yes, just give me a minute. Is my screen visible to everyone?
Yes.
Okay, so namaste everyone and a very good evening. I'm Dr. Manisha Shrestha. I'm working as a pediatric ophthalmologist at Bharatpur Eye Hospital. And today I'm going to discuss the scenario of ROP at my setup at Bharatpur. So it just flows like a story. In fact, I saw in June 2022, an idea came to me. I wanted to look at what is the number of the premature babies who are coming to us. And I looked at our medical records and I found out that there are very less number of babies that we are screening at our setup at that time, like roughly 2 to 3 babies per month only. So we know that because Bharatpur is blooming as a medical hub and there are lots of hospitals with NICU facilities available, there are lots of premature babies being born, but why are they not being referred to us? That was a question that came to our mind, and we thought maybe the pediatricians are not referring them. So what we did was we organized a CME program. So this is a picture of the CME program, which was held in June 2022. Where we called the pediatricians and the pediatric residents working in and around Bharatpur. And here we wanted to highlight that ROP as an important issue for preventable blindness among the pediatricians and the residents. So before we started off with a formal program, we also handed out a CAP questionnaire so that we were able to assess their level of understanding about ROP. So in that, in this program, out of 63 pediatrician residents who work in Bharatpur, 43 were present. So it was a good attendance. That is like 68% were present there. And their mean age was 35 plus minus 9 years. And out of the 43 present, 62% were qualified pediatricians. And 32% said they are examining around 11 to 20 preterm children per month. As mentioned earlier, the CAP questionnaire had questions with a total score of 22 points, and more than 50% had an average knowledge score of 10 to 15. So after this program, what we did was we made a pro forma to catch hold of these patients who come for the ROP examination. And that was done from July last year. So till date, we're able to examine around 52 preterm kids, and we ask them to come for follow-up examination, usually every 2 weeks or according to the severity, and totaling up all the preterm examinations, the ROP examination done till date, we were able to do 90 such. And majority were male, 58%, and the average gestational age was 32 plus minus 4 weeks. The mean birth weight was 1590 plus minus 450 grams, and majority were delivered by a C-section. We also looked at what were the maternal risk factor. 20% had maternal hypertension, and few had maternal diabetes, antepartum hemorrhage. We also had look at the neonatal risk factors. So 10% were on ventilators, few had neonatal sepsis, hyaline membrane disease, and the average days of NICU admission was 11 plus minus 12 days. The average days of oxygen therapy was 6.6 plus minus 8.3 days. So as I mentioned earlier, out of the 90 ROP examinations or observations done, we were able to see ROP was present in 9 of them, and out of which in 8 it resolved spontaneously, but in 1 we had to refer them for the laser treatment and needful. Though we do the ROP screening at our setup, we still lack the adequate facility for the anesthesia as well as post-operative care. So we're not doing the treatment per se at now, which we plan to start. And again, I went back and looked at the number of the preterm kids who are admitted at the NICUs at Bharatpur. That's like 1 year data of 2022. And these are the three major hospitals in my area. First one is Bharatpur Hospital, that is the government hospital, and rest two are the medical colleges. In 1 year, the preterm kids, that is less than 34 weeks and less than 1750 grams was 248, and majority were in the Bharatpur Hospital, that is 61% admitted there. So now I did my maths to find out how many kids were I able to screen out of them. So roughly it was like around 42%, but still 50% or half of the people are not coming to us. So now again, it kept my brain scratching about what could be the barriers. So what are the things that are stopping them for having their ROP screening done? So first and foremost, it is the lack of in-house screening facility at these hospitals. What is happening right now is these hospitals, they tend to refer them to us basically at discharge, but the sick ones, the ones who are particularly at risk, are there in the NICU and not being seen. So there's lack of trained ophthalmologists, as we in the pediatric ophthalmology unit and the retina are only doing this. So there is lack of ophthalmologists who can do this in our setup, lack of infrastructure, as well as lack of timely referral by the treating pediatricians for ROP. Also, ignorance among the parents and the guardians regarding how important this ROP screening is so that the preventable blindness can be prevented on time with adequate treatment. And as economic constraint, it is going to be heavy on the pockets. Yes, that's true. Then what we know the barriers, so what can be done to overcome them? What could be the way forward? As I already mentioned, these sick babies are not going to come to us, so we must go to them. And we have thought that we partner with these hospitals, or at least Bharatpur Hospital, so that we go there and do the screening and the needful on time for them, as well as to train the ophthalmologists for the ROP screening. And maybe we can also have funding for the fundus camera. We can train the NICU nurses or the medical officers to use them to click pictures, and they can share the same with us. And via ophthalmology, we can do the needful. And also strengthening the ophthalmology services, as it is not a one-man show. It is like a multi-speciality approach which needs to be strengthened. And foremost, to spread the level of awareness among the treating physicians as well as the general public about this preventable blindness due to ROP. So lastly here, I would like to quote what Neil Armstrong said: "A small step for man, but a giant leap for mankind." Doing the small steps, screening these small babies, yes, we are making them cry when we are doing our examination, but that's for their own good. And for that, we are saving the lot of sight years ahead of them, and which is the essence of today. So let us all pledge that we shall all unite to fight ROP. That is all I have to say for today. Thank you all and have a great day.
Very nice presentation, Dr. Manisha.